Thank you for everyone for coming today for this very exciting event. I must tell you, we were a little nervous about the weather. And yesterday it was supposed to be cloudy and cold and windy, and we've had this perfect day. And it could be better time for such a perfect event. And I want to welcome everyone to our groundbreaking event. It's a historical event to kick off the James LeVoy Sorenson Center for Medical Innovation. And as we kick off today's activities, I want to thank and recognize our speakers today and those who are in attendance. We have President Randall, President of the University of Utah. We have Mike Good, CEO of University of Utah Health. We have all the Sorenson family members. We have the Center for Medical Innovation Board of Advisors and staff. We have Center for Medical Innovation donators. We have guests, family members, state and community leaders. We have medical school leaders and faculty and physicians and deans from across the campus. And we have a lot of our student bench-to-bedside innovators here with us today. The James LeVoy Center Medical Innovation is like no other life science innovation facility in the country. And I'm being very careful here, but I think maybe even in the world. Its design, its mission, its programs, and the technologies that it will create will set the University of Utah apart from all other universities. With its state-of-the-art designs, it includes all of these features. 3 different levels of innovation prototyping centers where you actually build, test, design your medical device ideas. It has technology startup incubators. So when we have startups, they now have a place to reside while they're working on their technologies. We have clean room manufacturing, ISO 7 clean room, which is about 90% of medical devices. So we can do animal studies and first-in-man clinical trials. We have an in-home innovation studio. In the next 10 years, 30 to 40% of FDA-approved devices will be devices that are used in your home. So we have to start thinking ahead of this, where hospital things will now be in your home versus having the patient come into the hospital. We have a 3D printing center where you can quickly print your ideas and make your ideas to build and test. We'll have a CMI conference center to host events. And we'll have a 10-table biotissue operating room. Now, I know this is before lunch, but we like to operate and work on live tissue samples. These are not embalmed tissue samples. They get very hard and rubbery. These are fresh tissue. So if you could imagine 10 operating room tables without walls, and say you're working on prostates, and you could have you could have the prostate on the table with your current surgical devices, but you can also have your design ideas and iterations on table 2, 3, and 4, and you can go back and forth on the current devices with your new inventions. This rapidly accelerates the level of innovation. Nobody has this room. Everybody wants this room. I was recently presenting this to a major institution of a major named hospital in the United States, and they stopped in the middle of my presentation and they said, "Mark, do you think, can you really build this building? Because you know we all want this building." And I said, "Oh, the groundbreaking's in 2 weeks if you want to come on out." They were shocked. They said, "How did you do that?" I said, "It's all donated money." They're like, "You're kidding." So I could just tell you, this building is like no other, and it will do things that's different than what other campuses can do. Now, many campuses around the world have labs, they have incubators, they have conference centers, but nobody has them in one building, and no one has that biotissue operating room. That's what makes it unrivaled. So I like to do things that bring lots of wins. What's exciting about this type of facility is medical faculty wins because they get new technologies to treat their patients. Students and faculty win because they can take ideas and develop into medical devices. The University of Utah wins as we create up high-quality life science startups. The university makes revenue, and the innovators make revenue. The state of Utah wins. We create new companies that are high-paying jobs and generate revenue for the state. There's over 1,600. This further strengthens our industry. Students win from across 30 different degrees will work in this facility and prepare them for a lifetime of working in the life science industry. And ultimately, patients win with new technologies to relieve suffering and cure diseases. What a powerful mission to generate so many wins for so many people in so many different ways out of one facility. This center could not be named after a more deserving medical visionary and innovator from the state, really in the nation. James LeVoy Sorenson was a prolific medical inventor with over 50 patents. Now, I was a young product manager working for Boston Scientific in Boston. We all knew who James Sorenson was. He was up there with like Bill Cook that founded Cook Medical and John Abley that founded Boston Scientific. He was up there, and I always was proud because I was the only guy that was from Utah in those early companies. But he invented things like the disposable face mask, single-use intravenous catheters, and his most famous, the hemodynamic arterial monitoring device that changed healthcare around the world and is still the gold standard in every country on the earth. How cool is that? And so it's been an honor to have this building named after him. I'm very grateful to the Sorenson Legacy Foundation and all the individual Sorenson family members that donated and supported us through this effort. This building would not be here without the entire family support. I'd also like to thank and recognize all of our other donators and supporters of this building. Now, the creation and design and development of this building was not easy. It took lots of different specialists and professionals to create this. So I'd like to thank some people. First, I'd like to thank President Randall and Dr. Good for their full support and encouragement. They've been fantastic. Second, I'd like to thank Just Encouragement. They've been fantastic. Second, I'd like to thank Justin Brunson from our CMI team. He's been amazing as we've worked through all the different details, and my full CMI team as we've gone room to room to room, deciding where every plug goes and every table goes, where every light goes. I'd like to thank our inspired architects from VCBO, Celestia Carson, Derek Payne, Carlos Lennon, Abazar Movdanan Rampton. And I'd like to thank our Jacobson construction team. They've been fantastic. Now, they haven't built the building yet, so I'm saying this in advance. I think Chris Field and Sean Robbins and Justin Giles are going to do an excellent job. And I'd like to thank our university team, Don Wagner and Taylor Maxfield, who literally manage and align millions of details to make sure everything stays together and works along to completion. And I'd like to thank Claire Martinez, who did this whole groundbreaking event for us today. So a round of applause for all these professionals. Now, if I could just sort of wax philosophical just for a moment. Medical device life science innovation is my passion. It is the mission of my life. This center represents more than just a really cool, beautiful building, and it is a really cool, beautiful building. But it's different. It's a gateway of endless possibilities for future innovators and students by providing access to cutting-edge research facilities, mentorship programs. This center brings together innovators from across the different specialties to invent new technologies. It'll create a palpable, tangible difference in the world for all of our innovators. And when I think of all the students that come through here and how James Sorenson would have loved to interact with those students and watch them innovate and guide them on their innovation, I think it'd be exciting. So this is about more than just healthcare. It's about shaping the lives of the next generation of innovators. And this next generation of innovators will be the greatest innovators of all time. This generation was born into innovation. Their whole solutions to every problem in their life is innovation. Everything's on their phones. It'll be exciting to see what this generation does in regards to inventing life science technologies that will bring light, discovery, inspiration, and solutions to unmet clinical needs. So it's my privilege today to introduce our speakers for today's groundbreaking events. First, we'll hear from President Randall, President of the University of Utah. After President Randall, we'll hear from our chair of the Center of Medical Innovation Advisory Board, Gary Crocker. After Gary Crocker, we'll hear from Christine Harris, who is one of the daughters of James LeVoy Sorenson, and talk about her father's amazing legacy. Then we also have a very special guest, one of our student innovators from our Bench to Bedside program, Libby Brooks, and she's going to talk about the technology her team developed to improve the diagnosis of cervical cancer. And then lastly, we'll hear from Dr. Mike Good, CEO of the University of Utah Health. President Randall.
Mark, thank you very, very much. Isn't it exciting to have such an innovator as a leader in the Center for Medical Innovation? Mark has more energy for this topic than anybody I've ever seen. He is the perfect man for the moment, the only guy I know that could stand up and talk about tissue samples in front of a group like this and actually held everybody, held everybody's attention. Today's really a historic day, in my estimation, for the life sciences and innovation life science ecosystem here in this state. This will be the nexus of innovation. Our university already does more federally funded research in this area than any other entity by far in the state of Utah. It is in the millions, hundreds of millions of dollars, closing in on billions of dollars of fundamental research. That research, of course, has to get to the public. It has to make it into the hands of doctors and into the lives of patients every day to make things better. In fact, I think if you read much about James LeVoy Sorenson, the namesake of this, he didn't do this for the money. He actually did it to make people's lives better. The money happened to follow because he was so good at that. I knew James LeVoy Sorenson by reputation. In fact, it felt like my entire career in business, I was bumping into people that had worked for him, with him, invented with him, and really his legacy is absolutely stunning. He had an ability to take smarts and science and apply it to extraordinarily practical problems and become hugely successful. If I could quote a little bit of an anecdote I just heard from his daughter Joan, his attorney used to say, "Boy, you fail a lot, but when you succeed big." And you know, that's what this institute and this building will do. It will speed up the process of innovation, which naturally actually is accompanied by extraordinary failures. But this has been carefully designed in a way that allows us to experiment and find those successes over and over and over again. Our life sciences industry is growing faster than any other industry in the state, and I believe in the state of Utah, growing faster than any other place in the nation. We've got many of our leaders here today, and it's good to see you. Thank you for being here. What it needs more than anything else is talent. And for us at this university, we try to create unique experiences for students and innovators to find their passion and develop that talent. It was said that even James LeVoy Sorenson's incredible aptitude, right, for inventing and seeing opportunities was actually outpaced by his ability to find people, to find diamonds in the rough, people that could actually do the work. And he found them because he was so persistent. He looked for those qualities of both insights, but extraordinary persistence, the ability to actually succeed through failure on a regular basis. Many of the people that have contributed to this building know that pattern. I see today many of our donors. Thank you so much for participating so enthusiastically, both in the programming in this building, but also the monetary donations. When you get those two things together, you know you've got some magic in a bottle. And I think that is what we are seeing today with the launch of this remarkable building. So thank you very much for being here. Thank you so much to the Sorenson family, the Sorenson Legacy Foundation. This will be a building that I believe will carry on your father's legacy for decades upon decades to come. Thank you very much.
You know, many of the folks in the audience, as I look around this room, knew and worked with, interacted with Jim. And I think all of you would agree that it's very difficult to imagine at this point a more fitting and ideal legacy statement for the creativity and the life's work of James LeVoy Sorenson than this remarkably innovative and groundbreaking Center for Medical Innovation. You know, this year, Jim would be living his 100th year of life. I think it's kind of fitting that we're acknowledging that landmark today with this dedication. Perhaps the most remarkable element of Jim's relentless surge, and I use those words advisedly, but the relentless surge of medical product innovation and creativity that characterized his career is that he literally single-handedly began the Utah-based medical device industry in the late 1950s. And he did that without any pre-existent life sciences industry ecosystem or infrastructure. Jim and his partners at Deseret Medical were the ecosystem. They were the infrastructure. There was nothing else to build upon. And from the ground up, he created the foundation for what is now, 70 years later, a vibrant Utah medical device industry, employing tens of thousands of Utahs. Now, many of us who serve on the board of the Center for Medical Innovation in the last decade or so had previously built medical device firms here in Utah. And we found that oftentimes we hired the bioengineers, the marketing experts, the sterile manufacturing managers, the regulatory FDA advisors, all of these folks who had emerged and were trained and were cultivated and influenced because of Jim's pioneering efforts. From a genealogical medical device industry point of view, you can trace it all back to Jim. In a very literal fashion, his impact, even today, ripples through many, if not most, of the device firms throughout the state. Jim's genius and the key to his remarkable productivity and success was his compelling combination of three outlets. First, he had the ability to have clinical insights and creativity and propose solutions to complex clinical problems, probably given his pharmaceutical background, his training in the Air Force, and all the years he spent as a pharmaceutical rep. But he combined those clinical insights with a rare sense of design and engineering instincts that reduced such insights to practical application. And finally, his mind was further enhanced by a deeply intuitive sense of what was achievable from a marketing and business operating point of view. Those three characteristics in one human being is a rare combination. Back in the late 50s and 60s, as Jim was creating his first medical device firms, that combination was not just rare, it was unique. So what a wonderful tribute to Jim's legacy that this rare combination of clinical skills, business skills, and product engineering skills is now literally being embodied in this James LeVoy Sorenson Center for Medical Innovation, which provides an absolutely novel university nexus of expertise for not just medical school input, but also drawing upon the expertise of the business and engineering schools. So this new facility, and with this new interdisciplinary focus, this world-class center will be able to leverage off this new and unparalleled combination of medical device marketing and prototyping labs and capabilities, simulated ICU and ORs for product testing and refinements, and regulatory and engineering resources. Truly, what is being created here will further enhance and enable the university faculty and students from across many disciplines to define, test, and create new medical products in a pace-setting, world-class environment, generating new technologies that will enhance healthcare worldwide. So on behalf of both the Center for Medical Innovation and the Sorenson Legacy Foundation boards, I want to finally express gratitude for the extraordinary partnership this last decade that has resulted in this outcome with the university administration, without whose leadership and insights and refinements this shared vision of an interdisciplinary center for medical device innovation would have never been realized. Specifically, I want to acknowledge and thank Senior Vice President Michael Good, who literally picked up the pieces of this vision in a difficult transition period and built upon the project goals originally defined by the Sorenson Legacy Foundation and kept things on track and moving forward. And a very special thanks to President Taylor Randall, who upon becoming president embraced and further enhanced the mission and scope of this new building and center, bringing from the business school his remarkable expertise in operational innovation and creativity and business skills, and making this center more than just an adjunct of the medical school, but a true and genuine interdisciplinary center of expertise here at the university. And finally, we at the foundation and the center boards are deeply grateful for the profound influence the past year or so of our new director of this center, Mark Paul. I can't tell you the difference that this one personality has made in achieving the vision that everyone wanted to do as a legacy statement for Jim. Mark's career as a leader and innovator at multi-billion-dollar medical device firms has uniquely grounded this entire effort with a professionalism and a sense of direction in medical device industry experience that brings a whole new dimension to this effort going forward. Thank you very much, Mark. Well, because of this great partnership with the university and all the administrative leaders who have inputted into this project, Jim's life and legacy will be honored with what is going to become clearly the nation's premier center for medical device innovation. I can't help but imagine that Jim is contemplating this event right now as we're here together, and he was often quoted as saying, "The best is yet to come." Thank you.
Hello, everyone. It is truly an honor to be here today to celebrate the groundbreaking for the James LeVoy Sorenson Center of Medical Innovation. Thank you, Mark and President Randall, and thank you, Gary, for sharing your insights into the center and how it aligns with the collaborative approach to invention Dad used. To the world, James LeVoy Sorenson was many things. He was brilliant, unique, intimidating, fearless. He was a leader, a philanthropist, an innovator. He was all those things and many more. But to me, the youngest of his 8 children, he was Dad. He was the man who showed up at my doorstep when my first child was born. My husband was busy with medical school, and I was a young mother at home alone most days with a colicky baby. For me, the constant crying of my baby and inability to soothe him was hard. I desperately wanted to make everything okay for him, but nothing worked. I was exhausted. I couldn't even take a shower without my baby crying the entire time. My dad saw a problem, and he sought to solve it. This was a critical aspect of who he was and how he operated. He had spent his childhood finding creative ways to make much needed money. But at the age of 14, he landed his first consistently paying job at a local peach cannery by fudging the paperwork so he could work under the guise of being 18. He did this to earn money to help his family during the Great Depression. But even at this young age, he wasn't just working. He was observing. He was inventing. My father wanted the job, but he believed there had to be a safer way to do it. After observing and pondering a solution, actually, I want to get back to my story if it's okay. I missed a paragraph. Okay. At the cannery, Dad worked his way up to the role as a lineman, a position that was triple in pay, but it was a dangerous role. The lineman oversaw 10 by 20 foot vats of boiling water mixed with lye, working to keep and adjust temperatures that would properly skin the peaches. It was done by observing the steam. One of the fellow linemen lost an eye doing the work, and several others had disfiguring facial burns due to the proximity required of the job to monitor the steam rising from the vats. My father wanted the job, but he believed there had to be a safer way to do it. After observation and pondering a solution, he built a catwalk in the rafters of the cannery, set up an eagle's nest, and watched the vats from up there. It worked, not only for himself, but for all the linemen. He saw a problem, he devised a solution. So, back to my colicky baby problem. It should come as no surprise that one day out of the blue, as I paced the front room of my home trying to soothe my baby, Dad showed up at my door with my grandfather in tow and a new baby swing. "It's battery operated," he said. "You won't have to wind it up to keep it going." He and Grandpa set that swing up. I placed my son in it, and he swung. He stopped crying. I put Dumbo on for him. He listened and watched Dumbo in the swing and did not cry. And I took a shower. As a young girl, Dad took me on my first remembered flight. He helped me feel less scared about the turbulence by explaining the mechanics. And my siblings and I can all attest, he helped us understand the mechanics of the world in which his mind occupied by bringing us literally to the table. One of my older siblings recalls he lined them all up at the kitchen table to help put catheters together, earning their way to Disneyland through the work they put in. This would have been in the late 1950s. A decade or so later, when I was 12, he sent me, my sister, and brother to Sorenson Research, where we were put in different departments to work. I donned a hairnet and joined a production team clipping catheters off plastic molds every day for several weeks. Together, we all played a small role in bringing his inventions to the world. Anyone who knew my father would tell you that his mind was always racing. He was always assessing situations, identifying problems, and seeking ways to solve them. But though my father had many amazing ideas, his brilliance was in the art of collaboration to solve a problem. He had an exceptional ability to gather just the right team of people to bring the ideas to life. A simple Google search will produce pages of results about the successes my father achieved. In his younger years as a pharmaceutical salesman, he observed specific needs that the medical industry had. His proximity to physicians and surgeons during that time sparked the idea of the disposable surgical mask and disposable venous catheter that was produced in the 1950s during his time as co-founder of Deseret Pharmaceutical. Later, with the founding of Sorenson Research, he made critical care safer by enabling arterial pressure monitoring through the creation of a product called IntraFlow, an inexpensive, elegant product with a pressurized catheter flushing system. It was the first of its kind. This device and many more of his inventions became commonplace in intensive care units and operating rooms around the world. He was a pioneer in the medical industry. In his life, he had acquired close to 50 patents in over 48 years. His medical devices became standard pieces of equipment and stepping stones for medical devices today. His desire to transform lives was also manifest through giving. Although there were many million-dollar gifts given to big organizations, he also made many small, quiet gifts and did this his entire life. He began taking care of his family at a young age. As an adult, he always carried $100 bills in his pocket, and he looked for ways to give them out to someone who would benefit from it, such as a waitress where he had just paid for a $15 meal. My dad's giving continues through the Sorenson Legacy Foundation. That was his desire and allowed us the opportunity for the gift of this building. He always had one eye to the future, always predicting what was needed, and always bringing the brightest minds together to meet those needs head on. It's this spirit of innovative collaboration that truly illuminates the legacy of my dad. We had the donation to the Center for Medical Innovation set up, but my siblings and I became excited about it when we learned what the Center for Medical Innovation was going to try to do with it, bringing teams together to collaborate in an earnest pursuit to advance medical care, to change lives through innovation. This is a continuation of what our father was so brilliant at. The center, with a mission so aligned with his life's passion and the way in which he worked with other great minds, bearing his name would mean a lot to him. This moment means a lot to our family, and we feel it is very appropriate to honor our father in this way, through celebrating the groundbreaking of the center that will bear his name, the James LeVoy Sorenson Center for Medical Innovation, because the work that will take place here is reflective of his life, his gift, his love. As we look to the future of collaboration at the James LeVoy Sorenson Center for Medical Innovation, with brilliant minds joining together to bring medical devices to market to change lives, we honor my father's legacy. And in doing so, I'll leave you with the sentiment you've heard before that he often expressed: the best is yet to come. Thank you.
Good morning, everyone, and thank you for coming here today and for all the support that you've all given to the James LeVoy Sorenson Center for Medical Innovation. My name is Libby Brooks. I am a student here studying biomedical engineering, and I'm a member of Sea Blue. Me and 4 of my peers founded Sea Blue for the Bench to Bedside competition. I first heard of Bench to Bedside when I was still in high school. I came to competition night just to see what was happening, and it was a truly inspirational experience for me. It had an impact in what I decided to do with my future when I went to college, and it also planted the desire for me to go into med tech and to compete in Bench to Bedside. Sea Blue, in preparation for Bench to Bedside, developed a blue light colposcope. A colposcope is a device that's used by clinicians to view the cervix. However, diagnosing cervical cancer using colposcopy is not always the most accurate screening method. So our device uses a certain kind of light that causes precancerous tissue to fluoresce brighter than healthy tissue. This can increase the accuracy of cervical cancer screening. It's a non-invasive and affordable method, and it can be brought into low-resource areas. This was an issue that was brought to my team's attention by our incredible mentor, Dean Wallace, who showed us that in these low-resource areas, the poor access to cervical cancer screening leads to several cervical cancer deaths, with as many as 94% happening in these areas. We were inspired to help to innovate to solve this problem, and it's something that we could not have done without the resources available from the Center for Medical Innovation. Bench to Bedside is an amazing experience because it helps students to do meaningful work. It's not the only thing that the University of Utah has done to help students to really be at the front of healthcare innovation. That's something that I have loved during my time here. There's so many research opportunities, incredible and supportive professors and mentors, and these opportunities such as Bench to Bedside. And the things that my team has accomplished while working on Bench to Bedside are things that I could have never imagined possible. There were many aspects to preparing for the competition, including engineering design, regulatory pathways, business models, patent law. Some of these things I was not familiar with, and I did not feel confident in my own abilities to accomplish these tasks. However, with the guidance of mentors, including Dean, and with all the support from the Center for Medical Innovation, including lawyers and professors, we were able to accomplish something just in the preparation for the competition alone that I could have never imagined to be possible. I could have never seen myself making something that could have such a meaningful change and a meaningful impact in the world. And everything that is developed for Bench to Bedside by my team and by so many other teams is more than just the competition. The businesses and innovation that comes out of Bench to Bedside is something that will have a meaningful impact on our communities and on the world. I have been so impressed by the amount of support that we've received in preparation for the competition, but also in the support that we've received even after the competition. The continuing support from business owners who have wanted to help us know what do we do now. The funding that we received from Bench to Bedside to give us what we need to further develop our prototyping and testing, and continued mentorship. I know that the things that happen at the James LeVoy Center for Medical Innovation will be able to go so much farther than they ever have before because of the funding and the resources that this facility will make available to students like me. People who think I'm just a student will realize that they're a lot more than just a student, that any one of us could be the next James LeVoy Sorenson. Any one of us could change the world, and any one of us could improve the lives of millions. So I am so grateful to be standing here today with all of you, with all of us who are united in this cause of making the world a better place. And this future that right now many of us can only imagine, and a future that's so much better than some of us might even be able to consider, will become possible with this facility. So thank you for all of your support.
Thank you, Libby, and all our students who really add a tremendous energy to the Center for Medical Innovation. I'm so honored. I want to thank you all for joining us today to honor James LeVoy Sorenson. I especially want to thank the Sorenson family. I appreciate your patience. To say this project has taken its twists and turns would be an understatement, but you hung with us, you believed in us, and so here we are today, about to begin the construction of this beautiful facility, and more importantly, the exciting things that will happen in it. And look where we're at. I don't know, this looks like Main Street to me, but more importantly, think about where we're at. We're right kind of at the juncture between the health sciences, with just over here, medicine, nursing, pharmacy, health, dental, just a little ways over there. But down this way, engineering, business, education, psychology, all of these disciplines that need to come together. This building sits right in the juxtaposition of that part of our campus. And I had to smile as I saw the tracks train coming and going. You know, we built the track station right there just for CMI. No, I'm kidding. But you know, I thought to myself, certainly on campus, as students and professors move up here, but I imagined a medical conference downtown, or one of the many medical businesses that you've heard about. And I can see people jumping on tracks to get up to CMI to work with the innovation and innovators that will soon take place in here. I'm also very personally honored to personally pleased to be able to honor James LeVoy Sorenson. You've heard about his inventions, but I lived them. So I guess I'm a recovering anesthesiologist, would be how I would characterize that. So by the time I entered operating rooms as a medical student and an anesthesia trainee in the 80s, the disposable face mask was in pretty widespread use by then. But the practice at the time, particularly as we progressed from the early 80s to the late 80s, we were still using a lot of those IV needles to put fluids into patients' veins. And even if you got the needle in the vein and started the infusion, the patient would move around. And eventually that needle would poke out through the back or the side of the vein, and you'd have bleeding and you'd have the fluid in the tissue rather than the vein. And so as we saw the plastic IV catheter, that it really changed all types of practice. And in the operating room, I'm going to embarrass my colleagues at Florida because they didn't pronounce it right, but it was actually referred to by name incorrectly as a Desiree 16 or a Desiree 18. Somebody thought it was a French company. So, but I mean, that's how profound that discovery was, is that the catheter was requested by name when you really needed a critical IV placement. And this just went on to really change the practice of anesthesia, critical care, and eventually in the whole hospital. And then this continuous flush device, with the plastic catheters, you could not only put them in the vein to put fluids and other blood and medicine into the patient's body, but you could also put the catheter in an artery, and then you would see the blood pressure every beat. A blood pressure cuff could only take a blood pressure every 3, 4, 5 minutes. But if you put a catheter in an artery, you could actually see the blood pressure every heartbeat. But if you just put the catheter in, it would clot off, right? The body would see this as a foreign material, and before you knew it, your catheter had a clot on the end of it, and the waveform disappeared. Enter the continuous flow flushing device, which just put a very low fluid that would continue to move through that catheter with just a couple molecules of a blood thinner, not enough to disrupt the body's clotting mechanisms, but just enough to keep the clots off the tip of that catheter. And so that device really revolutionized our ability to measure pressure in arteries, in large veins in the neck, and so on. So again, it's very, for me to come full circle now, to come to Utah, to learn where these inventions were created by this great inventor, and now today to see this facility and the programs in it being dedicated to him. I hope as we get to lunch, you'll look at these boards that rise out of the ground, listing his many inventions, some of the patent materials from the original patents. These were really critical devices in the evolution of clinical practice. And so with a great legacy, but as you've heard, also very exciting look forward, I hope, as Libby said, many of our faculty and our students and their teams will strive to follow in James's footsteps, to push the boundaries of medical innovation. And I think we have all of the right ingredients here at the University of Utah. So it's an exciting time to have a new home base, if you will, for innovation, for transformation. The James LeVoy Sorenson Center for Medical Innovation, the James LeVoy Sorenson Center for Medical Innovation is one of the things I've asked President Randall to consider for me post-sabbatical. So I will be back. I also want to several have talked about the national visibility this will draw. Earlier this week, I gave a lecture to the anesthesiologists and the surgeons at Harvard Medical School, and it was on innovation, physician innovation in specific. And in my slide deck were a number of pictures about the projects and the work going on at the James LeVoy Sorenson Center for Medical Innovation. So, you see the folks at Harvard, they don't offer a lot of praise, right? They think everything was invented there. But we're helping them learn that the epicenter is here. And then next month, with the help of Justin and Mark, we're going to be presenting from the podium of the National Academy of Inventors on our bench-to-bedside program. So we really, in a way, hope that we can export some of these great ideas to become not just Utah programs, but national programs. So I'm going to join the chorus and add, I too think the future is exceptionally bright. Thanks for being here.
You know, I would now like to take a few moments and thank those. I mentioned earlier that this building is all from donations. It's no state money. And so I'd like to take a moment and recognize and thank those who have donated so kindly to this project and this building and our program. First, the Sorenson Legacy Foundation, the Sorenson Impact Foundation, Gary and Ann Crocker, Dr. Julie Hansen, Bradford and Shannon Brown, Justin Brunson, Gregory Critchfield and Wendy Critchfield, Doxy.me, Sean Wojtek, Dan and Dina Lofgren, Danish Patel and Kalpana Patel, Dave and Marianne Perry, Kirk Ryrie, the Semnani Family Foundation, Dylan Turner and Christine Graham, Dean and Deanne Wallace, Ryan and Jenny Watts, and Brandon Welch and Tanya Welch. And we're not done yet. I still have a ways to go. So I have about 18 months to raise the rest of the money before we can finish the building. But I'd like to thank everyone for your donations. So thank you to all of our speakers. Before we go to the groundbreaking ceremony, I want everyone to take a minute, and we actually, when you break for lunch and break for dessert, we have 4 or 5 of our student bench-to-bedside teams here. Now, just so you know, our students invent more medical devices than our clinicians do. Clinicians are busy, they have lots of patients, they're busy, busy, busy men and women. But it's really exciting to see what our student innovators come up with. So we'll have Bloom Surgical here. During laparoscopic surgery, the tip of the laparoscope gets all gummed up with body tissue. They invented these little, they're probably going to be disappointed in my description, windshield wipers that go and it cleans off the scope. We have Sea Blue here, which is a novel way to improve the diagnosis of cervical cancer as light reflects off the tissue. We have some of our medical students here that want to be neurosurgeons, and they were watching how external drains are put into ventricles to release the blood from the brain. And it's really quite old-fashioned how we put those catheters in. And they came up with a new novel way of putting ultrasound guides onto the tip of the catheters that go to their iPhone. And it's 100% into the ventricle, straight in the first time. We also have Orthobolt here, which is a novel screw for pedicle screws for spine surgery, and a few others. So take a moment to talk to these students and catch the vision of what's going to happen from this facility with all of these innovations. And then take a look at all the innovations from James LeVoy Sorenson and many of our other doctors. So what I'd like to do now for our first, I'm going to do this like a wedding. Okay, so the first one, if everyone could stay in their seats, and we're going to ask all the Sorenson couples to come up with all the speakers here today, and we'll do the first digging. So if you could all come up. After that first one, we'll release everybody for lunch, but I do want to do a couple other pictures. I want to do all the Sorensons of all flavors, shapes, and sizes and generations to all come up after that. Next, we'd like to do the CMI board, and then the CMI team, and then anyone else that wants a picture. So your names are here, and grab a shovel, grab a hat, and we'll kind of get organized here. Thank you, everyone. Countdown. Okay, let's get everybody aligned to your names and grab a shovel, and you can put a hat on. We have plenty of hats. some of you will have to put 2 hands on a shovel. We'll do a countdown here in just a minute. Hey, now, fun fact, Claire, who organized this whole here, also worked for James LeVoy Sorenson when she was younger in one of his factories. Okay, I can share. Here, I'll share. All right, so don't dig yet, but everyone put your shovels into the dirt here. I'll do a countdown from 3, 2, 1, and we'll do the first digging. Is everyone good with those instructions? Okay. 3, 2, 1. All right, thank you. Now I would like to invite everyone, but if all the rest of the Sorensons like to come up, we'll take a picture with the whole Sorenson family.